Developing tonight, a north suburban community fired up after fallout over a local hospital. WGN's Brona Tumulty joining us live from Waukegan City Hall. Brona, this all centers around Vista Medical Center, which has had a number of ups and downs over the last few years, right?
Good evening, guys. Yeah, that's absolutely right. Possibly more downs than ups, with 3 owners inside of the last 5 years. Vista Medical Center, up until this past Friday, was a level 2 trauma center. On Fridays, when IDPH stripped it of that status, citing a significant lack in a number of resources. But it seems the alarm bells have been ringing for quite some time.
Well, we certainly disagree with the level 2 trauma designation being removed.
Faisal Gill, Chief Legal Officer for American Healthcare Systems, which owns Vista Medical Center in Waukegan, speaking with us today via Zoom about the revocation of the hospital's level 2 certification. That happened Friday, with IDPH telling us today in part that was done due to its absence of essential services needed to maintain this designation, including lack of a blood bank, anaesthesia, neurology, urology or a full-time trauma coordinator. This action does not affect other services at the hospital, but Gill says AHS's T's are crossed and the I's are dotted.
We have all the services. I don't know where the miscommunication was.
If all of those things are in place, Faisal, why do you think the coroner here in Lake County, for want of a better term, blew the whistle and sent this letter to the board back in December?
I think it's actually personal. She wanted to sit on our board from the very beginning, and we did not, we did not allow her to sit on the board.
He's talking about Lake County Coroner Jennifer Bannock, who voiced her concerns late last year in a letter to the hospital board, and again today.
Over the past several months, I have become increasingly concerned about what seemed to be an alarming increase in exodus in clinicians leaving Vista Medical Center. Mine and others' observations of a shortage in supplies necessary for patient care, and reports of Vista Medical Center not fulfilling its financial obligations.
Bannock has previously worked contractually with the hospital as a nurse anaesthetist, stating today those shifts ceased January 18th in the wake of her letter.
It's not retaliatory at all, but we're not going to have somebody working in our hospital who doesn't believe in our hospital.
With regard to financial obligations, Gill argues staff have always been paid on time, save for a slight third-party glitch during the last pay period, and adding yes, they do owe money to vendors.
We've only had the hospital for 7 months. In 7 months, we have to try to fix it.
The issue raised by many tonight at the city's council meeting.
We need a hospital in Waukegan.
In spite of the decertification, we're told for now it's business as usual for first responders, who've often diverted to other hospitals, as Vista was never a level 1 trauma centre.
Only about 60 calls last month would have had us divert to a different hospital.
But if it were to shut altogether, that would result in up to 30 calls a day, we're told, being diverted elsewhere, something everyone wants to avoid.
I want to have communication with that hospital, and I want to hear from them. That's the thing that's been lacking, is the communication.
Now, AHS did reiterate multiple times today that they are not leaving, that they are committed to the hospital and to the wider Waukegan community. We did speak briefly with the coroner tonight after the City Council meeting, and she told us that any aspirations she once held maybe a year and a half ago to sit on the hospital board were only part of an effort to help the hospital, and any whistleblowing done since then has not been retaliatory in nature. Well, live in Waukegan, Brona Tumulty, WGN News.